We bring all the components of care together, the entire spectrum of care.
And I think that's why we all go into this field, is to really try to do as much as we can for as many people as possible.
We really offer a number of array of services that go outside the typical hospital health system.
No one ever accused the Mercy Health System of being typical. Headquartered in rural Janesville, Wisconsin, population 65,000, its 19-year journey of transformation from losing market share to a 2007 Malcolm Baldrige National Quality Award recipient in the healthcare category is hardly typical. Neither is its role as an organization whose dynamic and expansive approach to healing goes well beyond medicine. In ways expected of a healthcare system, but also in ways quite unexpected and extraordinary, Mercy has become a comforting, reliable, and constant presence in the lives of the people and communities it serves. It wasn't anything like that 19 years ago when Javon Bay was hired as CEO.
When I came, Mercy had not added a new physician in 4 years, had declining market share for 6 years, was projecting a loss for that fiscal year 1989-90.
Mercy, then a century old, was a standalone hospital that patients saw as a primary care facility. For specialized care, they traveled to Madison, Milwaukee, or Chicago. Things had to change. Guided by the vision of an all-encompassing, coordinated, organized structure, they did. Slowly, over 19 years, piece by piece, facility by facility, service by service, more and more of that vision became reality. Today, what was once a single struggling hospital has grown into a nationally acclaimed system consisting of 64 sites in 22 locations throughout southern Wisconsin and northeastern Illinois. Its workforce, called Partners, which numbered 589 in 1989, now stands at just above 3,700 people. 285 doctors, 80% of Mercy's medical staff, are employees, and the organization generates $833 million in revenue annually. Underpinned by a culture of excellence based on quality, service, partnering, and cost, a most remarkable transformation has taken place.
What we call this vertically integrated health system, where whether it be from the time the patient enters the doctor's office, which is the beginning of the healthcare process, all the way through being hospitalized or needing home care afterwards, or going into a nursing home, or needing to get pharmacy services or home health service, whatever it might be, it's all provided by Mercy.
Awesome. So are we breastfeeding then?
Yeah.
Great. How's that going?
Good.
Indeed, it is all provided by Mercy. For the people it serves, the very young just beginning their lives,
And how many?
for those facing the myriad and complex issues of age, and for those in between, Mercy covers all the medical bases with its continuum of care.
Okay, this is the church where I got married. It was St. Pat's in Janesville.
Very nice.
Yeah.
From the Mercy Care Insurance Company, with over 30,000 members, to the innovative Mercy Health Mall, a former supermarket the company has converted into a convenient and accessible health and wellness superstore, to the rest of a wide spectrum of medical services. The organization is there for its patients. But at Mercy, being there means more than offering medical care. This is an organization that takes healing in the broadest sense literally, defines those words as a call to action.
Shouldn't take me more than 10 minutes, so just stop by when you get a chance. You're welcome.
It's always a good feeling to see individual patients, but when you can take a system and a process and apply that to a whole community of patients and people, you're multiplying yourself.
Which is precisely what Mercy has done. It has multiplied itself by aggressively finding ways to function outside the four walls of usual medical practice, to extend its reach, energy, and imagination so it can be a positive presence in solving community problems.
We have 2 right now and then 3 that are starting later.
In 1996, in response to increasing numbers of emergency room patients listing their cars as an address, it opened the House of Mercy, a homeless center that has provided shelter and more to over 3,500 people. There was a need. Mercy met it.
It's not really a part of a health system's mission. In fact, I think we're the only health system in the United States that has a homeless center. And we've coordinated with other agencies in the community to where we really put them on the path to getting a job, kind of parental training for how to raise children, more effectively, to being able to find permanent solutions to their housing.
There are many other efforts, too. The Child Care Institute, a residential facility for 9 to 14-year-old children with behavioral and emotional problems, is one.
The Child Care Institute was created in a collaborative effort when the Rock County community initiated some discussions with us about the fact that there were behavioral health issues with children, and they didn't really have a place to go. Often it's very therapeutic to take that child out of the home setting, to develop a treatment plan, and to provide them some help in getting their emotional issues under control and channeled correctly.
The list of services outside the typical hospital system and those within it suggests the depth of Mercy's involvement in and commitment to its community. Among its many initiatives and collaborations are a community health center, the first of its kind to offer a services-tiered payment approach, budgeting just under $500,000 a month for self-pay discounts in support of patients unable to afford their care. A regional emergency medical services training center that since 1990 has trained and recertified almost 3,000 emergency medical technicians and paramedics. A speakers bureau for community organizations, scholarships and training for nurses, health career awareness projects for students, low-income clinic services, free mammograms, screenings, clinics, education fairs, self-defense classes for women, and much more. Healing in the broadest sense.
Okay.
Ready, strike. No. Good. One more.
I think our employees are pretty much on fire. They're enthused, and that really does come from our culture. Culture is kind of like the air you breathe.
This will be the only time you'll be able to hit a cop and go home, all right?
I think you either have a very positive, supporting kind of building culture that feeds on itself, and that's been one of our key successes here, is a very positive culture.
Mercy's positive culture translates into workforce satisfaction results, which demonstrate the organization's dedication to being the best place to work it can be.
Are you guys going for? It'd be five days.
Something simple and thoughtful as a concierge service to help partners with day-to-day issues like planning a vacation or picking up dry cleaning is a perfect example of such dedication.
Thank you so much, Carolyn. Thank you.
Further evidence comes from Mercy's being named in 2007 one of the 100 best companies in which to work by Working Mother magazine, and its selection for AARP's 2006 Best Employers for Workers Over 50 Award. These are significant honors because over 80% of Mercy's partners are women and over 30% are over 50. The organization finds innovative ways to keep them.
They have options to look at, going to pool, going to part-time, or even to seasonal work, or even working at home some of the time. We have several partners that have moved into that, so we've retained them and we keep them within our system, very productive, many years of experience within our same organization and not leaving.
And so that led us to things like the Work to Retire program, meaning that our staff can flex the hours of their day, the days of the week, or the seasons of the year. And so a nurse can go ahead, she can take off those months, go to Florida, with her husband and maintain her benefits. And then she comes back in the spring and works for us 6 months a year.
That kind of thinking, creative, considerate, and directed, permeates every aspect of Mercy's existence. It is responsible for an organization that leads its Wisconsin market in inpatient services, outpatient surgery, and employed physicians. An organization whose overall mortality rate matches the best practice benchmark on the Care Science adjusted rate for the top 15% of hospitals in the nation. An organization that has become the largest employer in its region. And an organization that had 89,000 patient encounters in 1989 and today has over 1 million. A work environment that satisfies partners, a positive culture, the delivery of a wide variety of medical services, as well as services that meet specific community needs. These qualities characterize the Mercy Health System. Taken together, they give emphatic, realistic meaning to the words healing in the broadest sense.